management. So my intention was making people more aware of these cases and let the people get document the thyroid cases in a right way. Unfortunately, as we all know, that Ayurvedic communities really have very promising results in many healthcare conditions. But most of the time, unfortunately, most of the time, we don't document it in the right way. We never showcase our credentials in the right way. We never do in the right way. Rather, many times we do an exaggerations of what we do things. So the true sometime will be little bit away, and moreover, this exaggeration will create a poor image of the system itself. Just to give you an example, how important thyroid disease is. In SNA, in our outpatient center, in 2015, we asked the receptionist about something very simple thing. It's like a random sampling method. We asked the receptionist, we given a paper and asked the receptionist to ask, if every patient comes, you ask one question: do you have any thyroid problem? If they say yes, you just make a tick. If they say no, you just make a cross. And if you finish first 100 cases, just try, irrespective of any age, irrespective of anything, irrespective of anything, you just do this. And when you reach 100 case, you just give us that paper. Normally, when we were a clinician, we were expecting maybe around 10 or 5 to 10% of people may come. Very surprisingly, it was around 23%. So, and very surprising is that 23% of the people openly declared that they have a thyroid problem. And most interestingly, most of the patient has already prejudiced that, oh, this is something like a part of our life. We have to take this levothyroxine and just keep our life like that. Nothing more, nothing less. And another set of people, very interestingly, they think that they have some comorbidities due to thyroid, and they believe that, okay, this will not be cured, or this is already a disease that can we have to live with that disease and we cannot do anything more. Very interestingly, the 23% of the people, these are random sampling, so 23% of the people are chosen by a receptionist asking only a simple question: do you have a thyroid problem? So imagine how many of the people sitting in this reception, those people who doesn't know anything about thyroid, those people who have many symptoms called as subclinical thyroid dysfunctions, and they may not reach into an attention of a medical doctor. So this was really an interesting call in our mind. Since SNA has done almost 10 years before itself a seminar under our Founders Day under thyroid disorders, we had a long vision to do something more, very systematically, very practically, or very pragmatically, and more than that, to do something for the real medical science. As you know well, that thyroid disorders is one of the most commonest disorders in the endocrine disease. And people know very well about diabetes in the frame of endocrinology. Maybe even some people may be knowing a little bit about thyroid only when they recognize there's an enlargement of the gland. Otherwise, most of the time, people really doesn't care. But in the last at least a few years, people started recognizing these things because of other reasons. This is not very uncommon too. As you know that 10 or 15 years, people complaining of multiple joint pain and all, often they go to a rheumatologist or they do routine blood investigations, find their problem and do some prescriptions. And they often neglect the possibility of lack of any vitamins like a vitamin D, or lack of any scarcity of other systemic demands. But nowadays, even the simplest joint pain, many times even a general medicine physician also oftenly check for the status of calcium, vitamin D, etc. So this is really a trend, oftenly happens, and parallelly also with the thyroid disorders. In reality, even in India, statistics says that 42 million people suffer from thyroid. Maybe it is not the real number. The true number may be much more higher. And you know that women are more prone for that. I don't need to explain these things in a very elaborate way, but I'll speak more as a clinician perspective, so that you will be more interested to know how we do things. It is, even though it is true that the women are more prone for hypothyroidism, but the realistic fact is that when it comes to the men, it is even more difficult. That is my experience in the last 5 years. Maybe we have treated few thousands. We have documented more than 1,000 cases. So before the documented period also, we were treating many cases. So I don't want to exaggerate. So I can say roughly 1,000 plus, which we have documented. In general, the thyroid disorders are common in women. It's true, but it is not as seldom in the men too. Even the statistic says it is 1:8. That means male 1 to woman is 8. Some says 1:6. But in the reality, at least in Kerala, I can say at least 1:3. That much is there. Maybe men are not really conscious of the problem. And as you know well, that in general the thyroid gland.
Sir, please unmute. Okay.
Okay. Caroline? Yeah. As you know that the disorders of thyroid gland can be classified into two, like a hyper, and Hashimoto thyroiditis, goiter. I think you all already know these things. So I don't explain how it happens, all these things in an elaborative way, because you already know these things. And you know very well also that hypothyroidism is the most commonest functional disorders. And moreover, every 10, 1 among 10 affects the hypothyroidism. Interestingly, this is a crack here. This has to be cracked in the society, that even today, a large number of people believe that hypothyroidism or hyperthyroidism can be treated only with modern medicine. So if there is a hypothyroidism, the commonest prescription will be the levothyroxine, or under the brand called Thyronorm, maybe 12.5, 25, 50, 75, 100, whatever. Or if it is a hyperthyroidism, most common prescription will be the neomarcosol, which is again another combination by and large related with hormone. And there is a belief that at least in the context of hypothyroidism, very unfortunately, people believe that this is not at all get cured completely. But it is totally not true. And most of the time, there are 3 categories of people. They come for thyroid dysfunction in our clinic. One category, the most commonest category of the people are people who is already taking levothyroxine. There was a period they were very happy with the medication, because all the symptoms what hypothyroidism has are somehow subsided, and they are living with taking with that medicine. But over a period of time, they find that this is not comfortable. still they have a manifestations of classical symptoms of the hypothyroidism or vague symptoms of hypothyroidism like joint pains, like neck pains, like gaining weight, like a water retention, lack of appetite, lose of their mood, etc., etc. Many things, as we all know well. And they go to endocrinologist, and the endocrinologist, instead of hearing the detailed problem or analyzing the symptom, blindly endocrinologist will increase the dosage. If she is taking 50 mcg of levothyroxine, mostly it will be increased into 75 or 100. So what happens is that the patient really disappoint for two reasons. One reason is because the patient's symptoms are not really heard by the endocrinologist. Often this is the thing happens in many other clinicians too. Secondly, she realizes that how come this can increase and increase? Do I have to live with this medicine? So then there may be a possibility. People may start thinking there may be a possibility that we can go for alternative options. So most of the time, people will think for homeopathy in some places Ayurveda, some places Siddha, Unani, whatever, even naturopathy also. But in truly speaking, even with this much of statistical relevance and the dominance and the availability of the cases in the society, if you check the cross-section of the country or even inside Kerala, if you look at the number of practitioners who specifically mention about thyroid is very seldom. If you take now the 15, 25 or 28 thousands of Ayurvedic graduates, if you look at the practitioners plane, at least you take the 15,000 people of practitioners in the Kerala, how many of them really highlighted that they could be able to treat thyroid dysfunction, especially hypothyroidism? Most of the time, they didn't care. But this is a very unfortunate situation. We have to, if a disease manifests in the society with the significant symptoms, which has to be addressed very seriously, irrespective whether we have information in the book, whether we have a protocol, whatever. We have to address. Then comes the rest. So this is first category. Second category of the people is the health conscious people. People nowadays, especially in Kerala, people oftenly read Arogya Masika, the health magazines like Manorama, Arogyam, Madhrumimi, Arogya Masika, these type of health magazines. And many of the time, this type of magazine is a very good appetizer for the seekers of health. Those who are feeling a little bit mood off, if they read an article about the symptoms of the depression, they definitely themselves decide or themselves diagnose that they have a grade 2 of depression. So these type of magazines are actually is a bread and butter of many doctors too. Still, we are all practitioners. Often we write articles in these magazines, so we should not say these things in a platform. But still, it is a fact, because this will create a lot of curiosity or some confusion or misinformation, so that they will approach a doctor so that we can have our bread and butter. But there are people, a category of people, this type of people, who when they read the magazines, so what happens is that when they read the magazines, they will find some of the symptoms what they have are coined with the thyroid dysfunction. So they will go for a self-prescription or a self-investigation to a lab. They will check the T3, T4, TSH. And unfortunately, they will find that the TSH is high, maybe 10 or 15, whatever. And this made them to realize that, oh, my diagnosis is perfect. So now it's my turn to go to hospital or to meet an endocrinologist and start treatment. So this is the second category of people. But normally their first choice will be a modern medical doctor. But there are people, they find that, okay, now it is only a borderline. Now the TSH is only 7 to 10. So they may have a family physician. He may be an Ayurvedic doctor or a homeo doctor. Oftenly they are more familial doctors comparing to the Western medicine, at least nowadays. So what happens that they will approach an Ayurvedic doctor. Since I'm a family clinician, many of the client will ask, doctor, my wife checked her TSH and recently I found her TSH is 10. Can you do something in Ayurveda, or shall we go for an alternative option like that? So this is the second category of people. And third category of people, those comes with goiter. They go for different functions. When the people go to different functions, and when they see people asking them, madam, why your neck is a little bit swollen? Do you think some problem there? So like that, or sometime when we look at the mirror itself, we may find some palpable or some change in the neck. Maybe it may be a temporal change. Maybe a reduction of the fat from the neck area too can increases the Adam's apple and all, but still. It create a lot of suspicion in the mind, or sometimes it is a real nodular growth creating a goiter, whatever. Anyhow, they will come to a Ayurvedic doctor to do this. So these are the three commonest categories of people, but there are other people too. I'll come to that point. Anyhow, so these three category of people will calls out of help, asking Ayurvedic community, do you have any approach in Ayurveda? Any promising management you have? Luckily or unluckily, we say Ayurvedic books doesn't explain anything about thyroid gland itself. If you look at since I am an academician as well, so if you look at go through the Sushruta Samhita whole book, it is very difficult to find a description of thyroid gland. Okay, you may say that, sir, it is described as a Galaganda, Gandamala. Okay, those things are different. This is a pathological thing. But I am speaking about in the dissective area. Of course, when Sushruta can able to say Avasini, Lohit, Ashwetatam, Ravedini, Rohini, like the thin layers of the skin, which is a 118 free he, 116 free he, 180 free. How can he miss such an important organ that located near the trachea? This may be a primordial question. It comes in the mind, but it's not missed. Rather, he considered it as it is something very different. Only those who are really inclined to know how Sushruta approached the anatomy is not the conventional structural systematic anatomy. The he approach was totally different, more like an embryological anatomy. So because of that, he doesn't miss, rather he included things on a very different way. He missed the pancreas, he missed the spleen. Doesn't mean that he missed, rather he categorized in a different way. Anyhow. So the question is now, this is another category. Another fourth, there is another category too. That category of people are those people who is already taking T3, T4, the levothyroxine, and even with these, they are not happy with that. Their symptoms are coming because of the cellular resistance of the tetrahydrothyroxine. Triiodothyroxine. So they are looking for a safer, a long-lasting therapy. And based on that, people also seriously approach to Ayurveda. But as on today, still, it is very not an established treatment is yet to come comparing to any other system. So I congratulate the organizers, because such type of programs will give a lot of idea for the clinicians how to look at a thyroid dysfunction case and how to do things the way, so that they can also convince the patient in the proper way what and all things can be done. Also, the other side, it is also help all people to confidently communicate to the patient stating that we have established treatment methods in our system. So next comes the physiology and function. I don't elaborate these type of things because you know very well, because you're already heard previous presentations. What is the thyroid gland? How it is things happening from hypothalamus, from pituitary to thyroid gland, then thyroid gland to the target cells, then negative feedback mechanism is almost like, I can say, like a battery of a mobile. If it functions quite well, because it's highly essential for almost all the functions of that thing, thyroid hormone is highly essential for almost everything happening in the system. Almost everything, maybe spared by the root of the hair where there is no blood circulation, or the tip of the nail, maybe that's all. But rest of the other places, definitely every cell has a really need of thyroid hormone, because it's one of the thing, especially the triad thyroxine, which is more receptible to the cell, essential for BMR, the basic metabolic rate. And also, it is essential for the glucose catabolism for energy. So definitely it's needed everywhere in a cellular level. Meantime, the systemic level too, as cardiovascular system, musculoskeletal system, everywhere it is very, very evident. So if we look at these things in a broader way, almost all the 5 vatas are involved. I know that your previous speakers might be told many things about these things, so maybe a little bit confusing if I say these type of things. But to justify what I'm done, and to justify or clarify how this treatment principles working, I'm using my own ideas in this context, which will be very helpful for you. So look at the whole scenario here in the context of thyroid. See the pranavada, udana, and samana with the dhatu agni, vyana, and all the 5 vata are indirectly or directly it is involved. Chair. Just 1 second. So directly or indirectly, almost all the vata is involved. And when all the vata functions at its best, thyroid also functions its best. If vata has the different perceptions, different realities, majorly due to some avarana situation happen, there are high possibility to have thyroid functions. That will come later. If we look at the whole situation, already you might have heard about the pathogenesis. The previous speaker might have told, maybe Mukesh may be told in a different way. But if you look at practically, there is a nidanam. We don't know, maybe many things may happen. There is a kapavritti will be there, Agnimandya is there, Amutpatti will be there, and Rasadushti, Medadushti, and Sarahinada. So there is a symptoms like Gurugatrada, Aruchi, Vak Swaragraha, like this type of kapavritti lakshanas will be there, majorly in hypothyroidism. And then we have Agnimandya, then Asvedana, or feeling very cold, or feeling poor responsive to the temperature, like that. Then comes the systemic problems like that. I personally like to say this condition is like a Gada Avastha of dosha into different dhatus. Especially so for hypothyroidism is concerned, it is the gada avastha of kapha into rasadi dhatus. So initially in the hypothyroidism, we will have a rasagada kapha, then we have raktagada kapha. That is why Ashtanga Sangrahara mentions kaphe rakte tu pandutva. So we have many of the thyroid dysfunctions are mimicking in the context of Pandu disease. Like that, it go to Mamsa, Meda, like that. Just to give you an idea how things are. Already you know much about hypothyroidism, how these symptoms are, but be very careful to analyzing the symptoms because many of the symptoms are a very vague symptom, very, very vague symptoms, and sometimes even the symptom may mimic many other diseases which are not very uncommon. Like an anemia. Anemia and hypothyroidism looks very similar. People, those who have obstructive sleep apnea, nowadays OSA is very, very high. With the snoring, continuous snoring for many, many years, next problem they manifest will be an obstructive sleep apnea. So when we have sleep apneas, they also feel this type of fatigue, weakness, constipation, edema. So it may also a little bit mimic situation. Dementia, again, many of the hypothyroidism have a very similar symptoms of dementia, like mild depressions, memory disturbances, muscle cramps, and vitamin D deficiencies, adrenal insufficiencies, even Lyme disease, which is not very common in our country, also. In pediatric cases, it is very, very important to look at. Easily, our presentation will be the enlargement of the tongue. So, if you get a child 4 or 5, if you look at the child face, it is very easy to diagnose. Most of the time, they will have a typical tongue protrusion and slightly enlarged. You maybe don't take all the cases with the tongue protruded by the children as hypothyroidism, but it is very, very common to find tongue protrusive nature in the thyroid dysfunction in the children. Another simple thing, what you can do if you are suspecting hypothyroidism is you ask the patient to keep the leg in the chair and do a tap on the Achilles tendon. When the thyroid dysfunction is establishing, especially hypothyroidism establishing, so if you tap on the Achilles tendon, normally Achilles tendon is respond quite fast. The movement of the foot will be there. But if there is a hypothyroidism, definitely there is a decline or the slowing down of Achilles tendon response. This could be a very, very simple technique by which your physical diagnosis to hypothyroidism may be sharpened and confirmed by checking at the T3, D4, TSH. So now next comes the basic thyroid evaluation. This chart you know already. Maybe previous speakers already told about this. The especially important is to check the free T4, not simple T4. And many times it is not much necessary to check the T3. TSH and free T4 is more important than T3. Because if there is a lot of free T4, so T4 is a tetrahydrothyroxine hormone which is circulated in the system, but it is less susceptible to the cells. If at all body needs more and more thyroxine, generally body releases one molecule of iodine which is binded with the T4 and it becomes T3, which is generally less number is available and that amount of free T4 will join because it's lost one iodine, become T3, and it will be cellular receptable and applied in the system. So if you check it, the free T4. So if you see free T4 is very, very low. So free T4 is low. That means there are one iodine is losing and T4 is utilized in the cell, but still person is having symptoms. So this is a typical situations where you have primary or a secondary hypothyroidism, depends upon how TSH and T3 level is. So this graph will be very, very, very sharp enough to give a better picture. I think maybe your previous speakers might have already told these type of things. If you were to explain these type of things, we do it maybe in the next lessons if you all have a really need of explaining these things. But I don't do now because it's already, I believe you are already well versed with these type of things because these are very crucial to identify things. This is a typical chart many times you find. Most of the time you see this chart attached into a lab investigation report. This may be based on different school of thought like American Thyroid Association or National Thyroid Association or British Thyroid Association. There are different associations made different assumptions, and these are some of the basic ideas they communicate in this. Now let us come to the point. So I'll put it directly into the practical thing. Then we discuss more how things are working. So if you have a hyperthyroidism, okay, keep it in mind that there is a huge increase of pitta and vata, and there is a decline of kapha. So you need kapha manda pitta vata dominant treatment. So what you can choose? You can choose Drakshadi Kashayam. You may use Vidaryadi Kashayam, Tiktakam Kashayam. These are very commonest prescription. Draksha, Madhu, Samudra, Kashmiri Shadiba of the Jaratigilsa. Or Vidari Panchangala Vrchigali, Vrchiha Deva, Vesukya Varna, that Vidaryadi Ganam of Shodhanadi Gana Sangraham. Or the Tiktakam Kashayam, Padola Nimbagaduga, Darvi, Padha, Durala Mayoga of Kustajilsa. All these three yogas depends upon the symptomatology you can choose. Again, I want to highlight is that even though we can definitely make a very well structured thyroid management protocol, as a clinician, I don't recommend at all to follow any protocol. Rather, you develop your own method of analysis. So we have a list of medicines and you choose which is appropriate to the given condition. So person is having cardiac disturbances. Person is telling, I'm very weak, if you find he is a little bit anemic and all, definitely Drakshadi will be a good choice. Whereas it is a Hridyam you need, then Vidaryadi will be choice. If a person is telling that doctor, I have severe burning sensation in my body, I am getting sometime edema. Angioedema is also very common presentations in thyroid dysfunction. So then you try Tiktakam Kashayam. So the concept here is to have a Shadiba, Chandana, Ushira, this type of toya to reduce pitta. Ahara Vithi, different type of food that will reduce Atyagni will be a choice. Kalyanaka Kırdam, very, very good choice. Virejanam with Avipatti Churnam, very good. Sarve Sama Samusida, Chaudrena Gudigi Krda. Instead of Chaudra, we may use Shira, will be a better choice. Chaudra is also fine, but it will create a little bit Vata. So, well better we can use milk. Kshira Kashayam with Truvurt or Shyama, special treatment like Thalapodichil, very, very important. Thalapodichil will give very good result in the hyperthyroidism. Generally, Snehapana is have to be very careful when you have hyperthyroidism. It can be done. You may start with a Pitta Shamana Kridam or like Kalyanaka Kridam or Tiptaka Kridam. Then go for Virechana with an Uttama Matra. You will get very good result. Normally, this type of patient may be already taking neomarcosol. So, don't stop the neomarcosol all of a sudden. So, because it creates cardiac arrhythmias, it may create mood fluctuations, little bit maniac disturbances. So, don't stop all of a sudden. Ask about the story how this thyroid dysfunction happened. There are many people who have different stories. One of the commonest reason to have thyroid dysfunction in our country is the usage of lithium. The drug which is used for schizophrenia, the drug which is used for many psychological or psychiatric problems are often are very commonest drug to produce thyroid dysfunction. Now comes the another prescriptions like Mahadiktagam, Shadavidyadi, if you that patient complaining of joint pain, other things, Padoladi Kashayam, then regular Virechana, Sumare Arindam, will be a very good choice. Weekly Virechana will be a very good choice. Toya of Shadangam, except Shundi, Nishundi Shadangam. Kanajandana Shundi Ambu Parpado Shira Sadidam. You take out the Shundi, all other medicine you take and use as a toyam will be a very good choice. Again, Kshirapagam will be a great choice. Even the Vidajadi Kashayam or Parushagadileham, Kushmanda Rasayanam, these are set of medicine which will be very, very useful in the management of hyperthyroidism. So Dr. Jidesh and we were working together for thyroid many cases. So we were also trying to use many Rasaushadhas like Pravala Basmam, Kamadugam, Devasudha Shegadasam, Shangabasam, etc. Since Dr. Jidesh is already going to speak to all of you in the coming days, so I don't describe these type of things and I don't want he to be disturbed by seeing his own content I am expressing here. So I will do, I think Jidesh is not there in the line anyhow. So he will do that. So now comes the hypo, which is the commonest thing is. As I mentioned before, we can definitely draw principles of treatment, which you might have heard about. Pradeep may be told many things. I personally, in the cases what we use is one of the commonest prescription is Hamsavatyadi Kashayam. Hamsavatya Madanimba, Pipili, Vishageshudam, Yogam. It is not mandatory that we should use Hamsavatyavadi. We may use Guludiptagam Kashayam. We may use Varnadi Kashayam. That is Nimbamra Vishapadola Diktiganam. That Guludiptagam or Varana Sairi Mashadavari, Dharanamolda Vidyavishaniga, Varanadi. These type of yogas you can use. Definitely you will get some results. But make sure that you randomly properly check the status of T3, T4, TSH, especially TSH. And meantime, check the symptoms also. If we don't have a real checklist of the symptoms, what they have, then it may be very failure while doing this type of medication because it not happens any miraculous result. So if you have a large number of symptoms enlisted properly, people will say from head to toe, you ask the patient, do you have hair loss? Yes. Do you have a cracking of your hair? Yes. Do you have a scalp dryness? Yes. Do you have a oral dryness? No. Okay, no. Do you have a neck pain? Yes. Do you have a throat pain? No. Like that, if you have a checklist of the symptoms, very specifically, and you ask the same symptoms after 2 weeks or a month, at least a month, and then very specifically you realize that how your prescriptions work, and if the symptoms what you see, which is some symptoms are disappearing, which is not at all told by the people, and if you find new symptoms are emerging, according to that, you have a freedom to change the prescription. There is no hard and fast rule that we should use only Hamsavatyadi, only Guglutiktam, Varanadi, Punarnavadi. There are many other yogas you will find in the context of things, because we are treating not the thyroid gland, we are not treating anterior pituitary or hypothalamus. We are really looking at this, correcting the whole system, which includes the correction of this thing. Then comes the Thoyam, that is the Panchagola Thoyam. Then comes the Ahara Viti. Okay, Panchagola is very good. If you are not able to give any medicine, at least if you give a Trikodu water, Trikodu Jalam or Panchagola Jalam, that is itself is highly worth interrupting in the thyroid management, even along with the thyroxine what they take. Keep it in mind that person is having Mandagni, Ama is there, some Shodhorodha symptoms are there. So keep those ideas in mind while prescribing any medicine. I'll give you example like people, those who are habituated to have day sleep, have high tendency to a thyroid dysfunction. So if you have a patient with hypothyroidism, you are strictly demand the patient not to sleep in the daytime, which is very, very important as a pathya. Maybe Sushila Saji madam will be explaining, because she may be very highly experienced in explaining hypothyroidism, also with her own experience in the cases with pathya. I have seen the program where Sushila Saji madam is going to speak about that. Another interesting thing is the Dadimadikram. In the context of Pandu Chikitsa, we have a wonderful yogam after Panduamayo, Pibedado, Kalyana Gakvayam, the next yogam, Dadimadikram. Dadimadikram is excellent yoga. Even both hypo and hyper, it functions very well. But in hypo, it is very, very competent to you. So if you get it for even the fresh case, TSH level is 20, 25, T3, T4 is normal, symptoms have just started emerging, or there is absence of symptoms, start with Dadimadikradam. Excellent, absolutely. More than 85% of the cases, you will get very, very good result. So it is, I have enough records to show you. Even today, I have treated a case where TSH was 108. TSH was 108. And she was taking 75 mcg. And I told her to reduce that into 50 mcg. She was a little bit surprised. Doctor, I have already TSH 108. I told her, don't worry. I'm going to start you with the Dadimadikradam. She complaining of joint pain, constipation, indigestion, many, many things. Only one medicine. Dadimadikradam. You take levothyroxine in the morning. After half an hour, you have breakfast. So just before the breakfast, you take a warm spoon, take the melted Dadimadikradam, have it in the morning, and slightly increase the dose in little bit into 5 to 7, 8 grams. Review me after 15 days. She has come, told that, doctor, I feel much, much better. Do I check again my TSH? I told no, because thyroid hormone half-life is at least 4 to 6 weeks. So if I want to check it, it is better you check at least 1.5 to 2 months. Minimum of 2 months, it will be better. Then her TSH is now, again, she come up with the TSH level into 10.2 something. Then I continued again. Now it is come to 5.3. Just by 1.5 months, 1.5 to maybe